May peace be on all of you. Myself, Dr. Majid Khan, Associate Professor, Loknete Dr. J.D. Pawar College of Pharmacy, Kalwan, Nasik. Today we have to discuss about the anti-arrhythmic agent. In this lecture, that is in lecture 1, we will discuss about the introduction, classification and important anti-arrhythmic drugs. So now let us start. The learning outcome of this topic. After completion of this topic, student able to know about cardiac arrhythmia, about ERP, effective refractory period, RRP, that is relative refractory period, SNP, supernatural period, and FRT, full refractory time. Classification of antiarrhythmic agent, understand mechanism of action of antiarrhythmic agent, draw the chemical structure of important antiarrhythmic drug with their IUPAC and uses. So what do you mean arrhythmia? So arrhythmia is defined as disorder of impulse, alteration of impulse and alteration in automaticity within the heart. Arrhythmia means an abnormal or irregular heartbeat. Arrhythmia may originate in the atria, AC node or AV node, whereby they are known as supraventricular arrhythmia, or in the ventricle, giving rise to the life-threatening ventricular arrhythmia. There are various causes of arrhythmia, which include atherosclerosis, blocking of vein and artery, coronary artery spasm, heart block, mostly AV block, and myocardium ischemia. So mainly there are two basic causes of arrhythmia. First one is alteration in automaticity. So what do you mean by automaticity? The heart exhibit intrinsic rhythmicity, not depend on CNS but on sympathetic and parasympathetic system. The heartbeat initiated by a specialized cell in AC node called as pacemaker. The AC node exhibit spontaneous depolarization because of their membrane is especially permeable to sodium ion. The action potential conducted across atrium via AV node. The conduction at AV node slower provide time for atria to emptying into ventricles before ventricle contract. So it is the automaticity. When there is an alteration in automaticity due to pathological changes, when SA node suppress, other specialized cell takes role of SA node and develop enhanced automaticity, and which leads to arrhythmia. So it is the first reason, altered in automaticity. Now second reason, that is alteration in conduction system. So what do you mean by conduction system? There is a special system for initiating and conducting the impulse which control cardiac rhythm, and it is made up of AC node which send impulse to AV node, from which they pass to AV bundle or bundle of his and passes to Purkinje fiber, and which may contract muscle fiber of ventricle. So this conduction mechanism is responsible for normal heart rhythm. So when there is a enhanced in velocity of conduction system, which leads to arrhythmia. There are some terminology here in case of antiarrhythmia or arrhythmia. So in that, first is ERP, effective refractory period. It is defined as the inability of myocardium to be re-excited immediately after depolarization is called refractoriness, and period during which excitability is reduced is called as ERP. So in diagram here is ERP is given. During ERP, cells are generally unresponsive to even strong stimuli. The ERP lasts from onset of depolarization until myocardium has partly repolarized to membrane potential. So during this period, ERP, if we give strong stimulus, the membrane is unresponsive. There is no action potential generation. Second is RRP, relative refractory period, in which only abnormal strong stimulus can initiate action potential. So after ERP there is a RRP. Here this one is RRP. So in which only abnormal stimulus can initiate action potential. Third one is SNP, supernormal period. Here is SNP. So in this period, even a small stimulus can produce action potential, but not up to threshold level. So in case of SNP, only small stimulus produce action potential, but it is not strong enough up to threshold level. Last one is FRT, full refractory time. So the interval between depolarization and complete recovery to normal resting potential is called as FRT. FRT is the sum of ERP, RRP and SNP. At the end of FRT, myocardial cell responds with normal threshold resulting in normal action potential. So it is a combination of 3 FRT, combination of this above 3. So it is the some term used in arrhythmia and anti-arrhythmic agent. Now classification of anti-arrhythmic drug. So it is classified as class 1. In this drug inhibit fast sodium ion channel. It is also called as membrane stabilizer. So class 1 membrane stabilizer. It is further divided into 3 types. 1A, class 1A, example quinidine, procainide, diisopyramide, etc. Then class 1B, lidocaine, procainide, maxilidine. Then class 1C, example flecainide, propafenone. So it is a class 1 subdivided into 3 types, 1A, 1B, 1C. Then class 2, it decreases the rate of depolarization. Generally it is a beta blocker, as we already study already in SEM 4. So there is a beta blocker. Example is esmolol, propranolol, acebutolol. Next class 3, that is inhibit potassium ion channel. Example amiodarone, sotalol, etc. Then class 4, inhibit slow calcium channel, means it is a calcium channel blocker. Example verapamil and diltiazem, nifedipine, etc. So it is the classification of anti-arrhythmic drug. So this image show how and where these various types of classes of antiarrhythmic drug act on which step of this cycle. For example, here if we see class 1 drug which act on phase 0, that is it is the initiation of depolarization phase. So these drug act on this phase. Class 2 act on this phase 4, it is a phase 4 class 2. Then class 3 act on phase 3. Class 4, that is calcium channel blocker, this one act on calcium play 2 phase, that is 2 phase. Then see first class, that is class 1 membrane stabilizer. So these drugs have membrane stabilizing property, act on myocardial membrane to slow conduction by inhibiting phase 0 action potential. They decrease maximum rate and depolarization. It also increase threshold level, increase ERP, decrease conduction velocity. Prolongation of ERP tends to abolish arrhythmia. These drugs act on sodium channel and blocked its function, preventing sodium conductance as long as drug is bound to sodium channel. Class 1 can be subdivided as we seen in classification based on a relative with which they dissociate from sodium ion channel. So class 1 is divided into 3 types based on the ease with which they dissociate from sodium ion channel. Class 1C are mostly potent sodium channel blocker. They slowly dissociate from sodium channel, causing slowing of conductance time of impulse through the heart. Class 1B dissociate rapidly from sodium channel and have lowest potency as sodium channel blocker. Class 1A have intermediate rate of dissociation from sodium channel. So here subclasses is divided based on the rate of dissociation of this drug from the sodium channel. So class 1C dissociate very slowly from the sodium channel, means this class 1C drug block the sodium channel for a longer period of time. Then class 1B, they rapidly dissociate from sodium channel, means this class 1B having short duration of action, or it block the sodium channel for a short period of time. And third one is class 1A, that is intermediate rate of dissociation from sodium channel. These drugs lengthen the ERP, slow down the conductance velocity. The affinity of antiarrhythmic drug on ion channel varies with state of channel. So generally every channel having some state, that is there are three state. First state of any channel is that is open, means ion are ready to enter or easy enter into the channel, means open state. Second one is activated closed. Activated closed means channel are closed but ready to open, that is called as activated closed. Third one is closed inactivated, means channel are closed but not ready to open. So there are three state of these any channels. A review of recent literature shows that antiarrhythmic drugs have low affinity towards the inactivated closed channel but high affinity for closed inactivated channel. So antiarrhythmic drug have low affinity toward the activated closed channel but high affinity for closed inactivated state. So example of these classes, first A class example is quinidine. So it is the structure of quinidine. If we see the numbering pattern, so from here numbering start 1 2 3 4, then this ring is also numbering is there. So IUPAC name 6-methoxy. So this one is 6-methoxy quinoline. This ring is quinoline ring. 4-eel. So here 4 attachment, 4-eel. 5-vinyl. 5-vinyl means this 5-vinyl. Quiniquilidine means this ring is called as quiniquilidine. On second position attachment 2-eel. Methanol. So this one is methanol. So this carbon attached to this 2 ring. Quinidine is a cinchona alkaloid which is a dextrorotatory diastereomer of quinine, which is an antimalarial drug. Structurally, quinidine is composed of quinoline ring. This one is quinoline ring. And bicyclic quiniquilidine ring. This one is quiniquilidine, which is bicyclic ring with hydroxymethylene group. This one is hydroxymethylene group connecting these two component or two ring system. From 2 nitrogen, the nitrogen of quiniquilidine, this one, nitrogen of quiniquilidine is stronger base than the nitrogen of quinoline. It always used in water soluble salt which include quinidine sulfate and quinidine gluconate. So it is the first drug, that is quinidine. Second drug, that is procainide. So it is the structure of procainide. IUPAC name 4-amino means this 4-amino, N means this N, 2 means this 2, and second position this group is attached, that is diethyl amino ethyl. So it is a diethyl amino and this 2 is ethyl. Basic structure is benzamide, benzene with amide. It is a benzamide. So 4 amino and 2 dimethyl amino ethyl benzamide. Procainamide drug was developed during the research for the compound structurally similar to procaine, which is a local anesthetic. Procaine is a local anesthetic, but procaine is a ester type of drug, whereas this procainamide is a amide type of drug. So procaine, which has limited effect as an antiarrhythmic effect because ester in nature and it is easily hydrolyzed in body, therefore short duration of action, procaine. But in case of procainamide, which is an anti-arrhythmic drug having amide bond and it is more stable than procaine. Next drug is lidocaine. So it is a structure of lidocaine. So if we see the IUPAC, the basic structure here is acetamide. So it is a structure of acetamide. Now IUPAC name 2N. So 2 means this 2, N means this N. Diethyl group. So here diethyl amino group. So here is ethyl. Sorry, here ethyl group is there. So diethyl amino N means this N. 2,6-dimethyl phenyl. So here on 2 and 6 there is a dimethyl phenyl acetamide. So it is a IUPAC name of this lidocaine. Lidocaine, similar to procaine, is an effective clinical use local anesthetic and it is reserved for ventricular arrhythmia and usually drug of choice for the emergency treatment of ventricular arrhythmia. It is effective only when given by intravenous. Antiarrhythmic activity is not observed after oral administration because of rapid and efficient first pass metabolism by liver. Next drug is diisopyramide. So it is the structure of diisopyramide. So first we see the IUPAC name. So here there is a butanamide. So here is a butanamide. Butanamide means 4 carbon with amide group. So here is numbering is given 1, 2, 3, 4 with this amide group. So 4 carbon with amide group, that is butanamide. So on 4th position, so this is the 4th position, 2 group is attached like this one, diisopropyl amino group. So 4 diisopropyl amino group. Second position on phenyl ring is there, 2 phenyl. On same second position pyridine ring is attached with second position. So it is a second 2-eel and basic nucleus is this one is benzamide. So 4 diisopropyl amino, 2 phenyl, 2 pyridine, 2-eel butanamide. This diisopyramide drug used in treatment of ventricular tachycardia. It has negative inotropic effect on the ventricular myocardium, significantly decreasing the contractility. Diisopyramide also has anticholinergic effect on the heart, which is responsible for adverse side effect. It is available in both oral and intravenous form and has low degree of toxicity. So it is also 1A drug, first A class drug. Then in case of first B class, the drug is procainide. So it is a structure of procainide. Here the basic nucleus, this one is 3 carbon with amide group, that is procainamide. So it is a propanamide, 3 carbon with amide group. So the IUPAC name 2 amino. So here is this amino group attached on second position, 2 amino. Then N means this N. This ring is 2,6-dimethyl phenyl. Basic nucleus is propanamide. So it is the IUPAC name 2 amino N2,6-dimethyl phenyl propanamide. The uses of procainamide. The procainamide drug differ from lidocaine in that it lack 2-ethyl group, which provide procainamide some protection from first pass metabolism after oral administration, hence use orally. So if we see this drug procainamide, NH2 group is there, but in case of lidocaine, here ethyl group is there. So difference between this procainamide, in case of procainamide there is NH2 group without ethyl group. Therefore this drug procainamide shows some protection against the first pass metabolism, therefore used orally. Next drug maxilitine. So it is structure of maxilitine. IUPAC name 1 means this one, 2 6, sorry, 1 means this one, 2 6 dimethyl phenoxy. So it is a dimethyl phenyl with oxygen, phenoxy. 2 amino. So here is 2 amino. Propane means 3 carbon. 1 2 3 propane. So 1 in bracket 2 6 dimethyl phenoxy 2 amino propane. This drug an ether and not subjected to hydrolysis. It blocks fast sodium channel in cardiac cell. It acts on Purkinje fiber, increase threshold excitability of myocardial cell, decreasing amplitude of myocardial action potential, and decrease the automaticity. Next drug, tokainide. So it is a structure of tokainide. So if we see the IUPAC name of tokainide, so here propanamide is a basic structure. So it is a procainamide 3 carbon with amido group. So again here second position amino 2 amino, N means this N, ring is 2 6 dimethyl phenyl propanamide. Tokainide is a lidocaine analog that does not have significant first pass metabolism. It is found in 2-9 tumors. R isomer is 4 times more potent as compared to S isomer. Next drug is profenon. So profenon, so it is a structure of profenon. So the basic is propenon. So this one is propenon, 3 carbon with ketonic group, propenon. So I pack 1. 1 means this one, 2 means this 2, again 2 means this 2, hydroxy, this one is hydroxy, 3 propyl, so it is a propyl group, third position pe, 3 propyl amine. Propoxy, propoxy means propane with oxygen group, so it is a propoxy. Phenyl means this phenyl, again here 3 phenyl, propenon. So IUPAC name 1 2 2 hydroxy 3 propylamino propoxy phenyl 3 phenyl propenon. It contains chiral center. So this drug contains chiral center. This one is marketed as a racemic mixture. Therapy with racemic mixture of profenon produce effect that can be attributed to S and R enantiomer. Although both R and S enantiomer exert similar sodium channel blocking effect, as N enantiomer also produce beta adrenergic blockade. As a result, S enantiomer reported to be 40 times more potent than R enantiomer as a anti-arrhythmic drug. Similar drug is leucainide. So it is the structure of leucainide. IUPAC name N means this N. This ring is attached, that is 4-chlorophenyl. Again N isopropyl piperidine. This one is piperidine ring with isopropyl group. On fourth position attachment is there 4-yle. Then on second position phenyl ring is attached, and this one is also acetamide. Then next drug is flecainide. So it is a structure of flecainide. So here the basic nucleus is benzamide. This one is benzamide, benzene with amide group. So flecainamide, N-piperidine methyl, N-piperidine methyl. So it is a N-piperidine methyl 2,5. So it is a 2 and it is a 5. Bis means 2 times same group, 2,2,2 trifluoromethoxy. So this one is 2,2,2 trifluoromethoxy benzamide. So it is the IUPAC name of this drug. There are some sharp point here. Is first one is most potent compound having 2 trifluoromethoxy group, one of which was ortho to carboxamide function. The para substituted derivative are less active. So first point regarding this group, this 2 group is there, one is and this one is here. So this group is ortho and meta substituted. According to this group is ortho and this group is meta. If we shift this group on para position, activity is decreases. Second point, replacement of this group with methyl chloro fluoro loss in activity. So this group we cannot replace this with methyl chloro and fluoro group. Third point, for optimum activity there will be 2 carbon between amide nitrogen and amine nitrogen. So this one is amide nitrogen, this one is amine nitrogen. So between these 2 nitrogen there should be 2 carbon for maximum activity. Next class, potassium channel blocker. Example, amiodarone. So it is a structure of amiodarone. So here is methanol. This one is methanol means this group methanol. So 3-butyl benzofuran. So 3 means 3-butyl means this one. Butyl group is there. 3-butyl, this ring is benzofuran. On second position, attachment to eel. Then 4 means this 4. 2-diethylamino means this 2-diethylamino. Ethoxy means this ethoxy, ethyl with oxygen, ethoxy. 3,5-diiodophenyl. So this 2 iodine group on third position, on fifth position. 3,5-diiodophenyl methanol. So it is the IUPAC name of this drug. It is iodinated benzofuran derivative. Iodine can be replaced by bromine or methyl and benzofuran by benzothiophene without loss of activity. So here iodine, we can replace this iodine by bromine or methyl group. Similarly, benzofuran ring may be replaced with benzothiophene without loss of activity. Next point, non-iodinated derivative also possible. So as we seen, iodine group is not requirement, so we can replace this iodine. So without iodine it also show activity. Example is dronidaron. So it is a structure of dronidaron. So IUPAC name of this drug N3-butyl. So here is N3-butyl means this 3-butyl group. 2 means this 2, 4 means this 4, 3-dibutyl amino. So it is a 3-butyl group 2 times dibutyl amino. Propoxy means propane with oxygen group, propoxy. Benzoyl means this group, benzene with carbonyl group, benzoyl. Benzofuran, so it is a benzofuran. 6-eel methane sulfonamide. So it is a methane with sulfonamide group. So methane sulfonamide. Third point in this case, substitution of indolozine for benzofuran in amidadarone gave butoprozine with high activity. So yeah, here a ring is changed. In case of instead of benzofuran, indozolene ring is there. So it is a butoprosine. It is a butoprosine. IUPAC name 4 3. So here 4, this one is 4, here is 3. On 3 dibutyl amino, this is a dibutyl amino group. Propoxy means this propane with oxygen, propoxy. This one is phenyl. 3 ethyl indozolene, so it is a indozolene ring, third position, ethyl group. 2 il methanol, so it is a methanol, so it is a IUPAC name. Next drug, that is beta blocker sotalol, so it is a structure of sotalol. If you see the IUPAC, again here is same group, methane sulfonamide, so it is a methane sulfonamide. So N means this N, 4 means this 4, 1 hydroxy means this 1 hydroxy, 2 means this 2. On 2 position, propane 2 il amino, so it is a propane means 3 carbon with amino, propane 2 il amino. Then ethyl means this ethyl, phenyl, methane sulfonamide. So sotalol can be validly used to maintain normal heart rhythm in people with life-threatening ventricular arrhythmia. So it is about the sotalol. Note here, for other beta blocker drug which are used as a antiarrhythmic drug, you refer semester 4 unit 2 drug acting on ANS beta adrenergic blocker chapter. So beta blocker you already studied in second year same 4 medicam. So for more drug of this category beta blocker, you refer that chapter. So it is about the anti-arrhythmic drug. So thank you very much. In next video, in that lecture 2, we will see about the calcium channel blocker. So if you like the video, then subscribe to the channel. Thank you very much.